Hello to my patients and my future patients. My name is Dr. Michael Pinell, founder of the Medical Aesthetics Center on beautiful St. Simon Island, Georgia. My Medical Aesthetics Center was voted the #1 medical aesthetic practice on St. Simon's Island by its residents and tourists in 2013. I'm an American board certified physician who has been trained, certified, and licensed to perform bio-identical hormonal therapy in this medical aesthetic center. I am making this YouTube video for you so you may become better informed about what is bio-identical hormonal therapy and actually what it may do for you to determine if you believe you may benefit from this innovative therapy. I'm hoping to create a trusting relationship with you by providing this new information. You will decide at the end of this video if you want me to perform this hyperbaric oxygen therapy on you. You will determine if this therapy is potentially much more beneficial than the price it will cost you for me to do this therapy on you. My goal for all of my patients is to improve their youthful appearance in a natural way while improving the quality of all aspects of my patients' lives. Why are your hormones so important to you? Hormones are the life force that animates us physically and emotionally. We have 60 trillion cells in our bodies that are communicated by our hormones as the chief messengers between all of these cells. They govern our growth and development as well as mental and physical functions. When levels of each hormone are in the right proportions, our bodies operate in a very stable fashion. When balance is lost, hormonal deficiencies and excesses can become toxic to our bodies. Only the correct bioidentical hormone fits the receptor to the cellular functions it regulates, like a key with a lock. Synthetic hormones cannot completely fit this receptor and are unable to optimally regulate our cellular functions. Let me now describe how each of our hormone centers work. The pituitary gland, our master endocrine gland, produces follicle-stimulating hormone to signal ovulation and luteinizing hormone to regulate sperm production. Both of these signals fall at midlife and the pituitary hormone levels drop significantly. The ovaries make female sexual hormones, estrogens, including estrol, estradiol, and estrone, progesterone, testosterone, and DHEA, that regulate menstrual cycle, maintain pregnancy, health to your bones, breasts, skin, blood vessels, heart, and brain. The testes are the male sex hormones, testosterone and DHEA. 95% of testosterone is produced in the testes. Testosterone is the key to bone, muscle, sex drive, and cardiovascular health. Adrenal glands produce cortisol that mobilizes us during stress and activates our immune system. They also produce DHEA that provides energy, mental clarity, bone health, and supports our immune system. The thyroid gland produces thyroid hormones. T3 is the active hormone and T4 converts into T3. These hormones regulate our body's metabolism. Hormone balance is deeply connected to the food we eat, the exercise we get, the toxins we absorb, and the stress level we live with. You cannot expect a positive long-term outcome if you spray your roses and your food with pesticides, microwave your food in plastic, eat French fries and hamburgers as your main food, and regularly stress yourself to the point of exhaustion. At midlife, most hormone production is taken over by the adrenals. If the adrenal glands get run down, we get run down. So supporting them with the right amount of rest, at least 7 hours, healthy nutrition, and appropriate activity, at least exercise a minimum of 20 minutes 3 times per week, is essential. At menopause and andropause, which is male menopause, our hormone levels plunge and hormone imbalances are very common. How do I detect hormone imbalance? I initially use saliva testing because it measures bioavailable active hormone levels. It is a painless and accurately measures estrogens, progesterone, testosterone, cortisol, and DHEA. Serum testing of hormones are less accurate because 98% of most hormones are bound to proteins in the blood. Thyroid hormones need to be measured in the blood, and I measure TSH, free T4, T3, TPO, and iodine. Retesting is very important and should be done between 1 and 3 months after starting hormonal therapy. What are the common types of hormonal imbalance? Estrogen dominance is very common in premenopausal and menopausal women. Progesterone declines 120 times more rapidly than estrogen in women whose ovaries are starting to fail and begin in the early to mid-30s. Estrogen dominance predisposes women to weight gain, especially in the abdomen, buttocks, hips, and thighs. The average American woman gains 1 to 2 pounds per year between the ages of 35 and 55 years of age. No matter how few calories you consume or how much you exercise, you will not generally lose weight if you're estrogen dominant. Also, fat cells secrete more estrogen that predisposes the body to gain even more weight. Estrogen dominance causes an increase in thyroid binding globulin, resulting in hypothyroidism that further slows down your metabolism. Finally, estrogen stimulates insulin release, so your body craves sugar, even when you're not hungry. How do you diagnose estrogen dominance? The saliva test shows a low progesterone and a low progesterone-estrogen ratio. How do I treat estrogen dominance? I use bioidentical progesterone and/or testosterone. It can be given as a pill, cream, vaginal suppository, or an IM intramuscular shot. Progesterone should be taken at bedtime because it helps promote sleep. Avoid alcohol, caffeine, sugar, and spicy foods. Daily exercise and avoid stress as much as possible. What is andropause? That is male menopause. It is low or subnormal androgens, especially testosterone and DHEA. Normal is not optimal, and I want you to have optimal levels to speed up your weight loss and give you more energy and strength. DHEA has a normal range of 2 to 23, but low numbers are less than optimal and should be replaced with 7-keto DHEA 25 to 50 milligrams orally each morning. DHEA is the main precursor of testosterone, and it builds lean muscle and bone mass while reducing fat. Low DHEA can cause low libido and general malaise, but high DHEA can increase facial and body hair and give you a deeper voice. Low testosterone was found in 40% of United States males over the age of 45. Testosterone is an anabolic hormone that builds and maintains muscle mass, bone density, strength, and stamina. It is also likened to libido, mental clarity, memory, and energy. How do I diagnose andropause? The saliva with a low testosterone and/or low DHEA. How do I treat andropause? I use bioidentical testosterone plus oral DHEA. Bioidentical testosterone may be given as a pill, cream, or an intramuscular shot. Women usually require 1 to 2% cream, and men require 5 to 15% cream that they use in the morning. Avoid testosterone robbers such as caffeine, alcohol, cigarettes, and unnecessary stressors. Get exercise and sleep at least 7 hours each night. High androgens, testosterone and DHEA, are common in women with polycystic ovary syndrome, but make sure that the patient did not take supplemental DHEA within 72 hours prior to the saliva collection. Symptoms are weight gain in the waist, excessive body and facial hair, acne, moodiness, irritability, and infertility. Treatment is eating high-fiber foods and adding flaxseed oil and cinnamon with adrenal supplements. Get exercise and rest. Adrenal fatigue is caused by low cortisol levels and rarely Addison's disease. Adrenal stress is caused by high cortisol levels and rarely Cushing's syndrome or steroid use. High cortisol levels cause insulin release that promotes fat storage and decreases fat loss. You are constantly hungry and have problems sleeping because high cortisol levels promote appetite hormones and disrupt your sleep patterns. Chronically, high cortisol levels have serious risks for cancer, osteoporosis, and possibly Alzheimer's disease. How do I diagnose adrenal malfunction? The saliva test with samples in the morning, noon, evening, and bedtime. Adrenal fatigue is treated with low-dose hydrocortisone, 10 to 20 milligrams orally each day. Adrenal stress is treated with 7-keto-DHEA and bioidentical progesterone for women and bioidentical testosterone for men. Hypothyroidism. It affects 10% of the American population, with women's risk being 7 times greater than men. 26% of women in or near menopause are diagnosed with hypothyroidism. Hypothyroidism has multiple causes. Imbalances of estrogen and/or cortisol. Low iodine results in goiter. Our water is generally high in fluorine and chlorine that displaces the iodine on the halogen chart that you remember in chemistry in high school. Hashimoto's or Graves' disease is an autoimmune disease with lymphocytic infiltration of the thyroid gland. Symptoms of hypothyroidism are tiredness, cold hands and feet, weight gain, hair loss, loss of the lateral eyebrows, a slow pulse, low libido, poor concentration, thinning of your skin, and constipation. How do I diagnose hypothyroidism? I check your TSH, your free T4, T3, and a TPO with an iodine level. How do I treat hypothyroidism? Iodine drops if you are iodine deficient. Then there are various other therapies depending on the diagnosis: porcine thyroid, Cytomel, or levothyroxine. Why do I only use bioidentical hormones for my patients? Bioidentical hormones are derived from natural plant sources and are identical to those that the body produces for itself. Bioidentical hormones do not increase the risk of cancer and do not support cell growth. Synthetic estrogen is produced from pregnant horses' urine, Premarin, and are cancer-promoting, and synthetic progestin, Provera, also stimulates cell growth to support cancer. If you're interested in having me or my women's health certified nurse practitioner, Cheryl Tyler, who is well-trained and experienced, having over 12 years experience treating her patients with bioidentical hormones, to evaluate you for hormonal imbalance, please call and schedule an appointment at 912-638-7799. At the time of your appointment, your credit card will be charged $350 for this evaluation, including your saliva test that costs $150, which is included in this price. Follow-up appointments will cost $150. We will obtain your email address so we can stay in touch with you. Thank you for your time you spent listening to me on this YouTube video.